Good morning, ma'am. Good morning, classmate. I am Fritzige Baguio from BSN Topat. Today, I will tackle about the protozoal infection of the genitourinary tract, which is trichomoniasis, and the protozoal infection of the CNS, the primary amoebic meningoencephalitis. What is trichomoniasis? Trichomoniasis, also called TRICH, is a common sexually transmitted protozoal disease affecting both women and men, but is more commonly detected in women. TRICH in pregnant women can cause problems in the pregnancy. What causes of TRICH? TRICH is caused by one cell parasite. In women, the parasite usually affects the vagina and the cervix, urethra and bladder, and glands in the genital area. In men, the parasite infects the urethra or under the foreskin of the penis if it is circumcised. The system involved of the trichomoniasis is the reproductive system. The pathogen of trichomoniasis is the Trichomonas vaginalis. Trichomonas vaginalis is a parasite protozoan that infects the orogenital tract of both women and men worldwide. The orogenital tract is the part of the reproductive system. Reservoir and mode of transmission of trichomoniasis. The reservoir is the human genital tract, and the mode of transmission is transmitted through sexual or genital contact. The sign and symptoms of trichomoniasis for women is vaginal discharge, profuse, thin, foamy, malodorous, greenish yellow discharge, vaginal spotting or bleeding, genital burning or itching, genital redness or swelling, frequent urge to urinate, pain during urination or sexual intercourse. The sign and symptoms for men it is discharge from the urethra, burning during urination or after ejaculation, and urge to urinate frequently. What are the risk factors for trichomoniasis? Multiple sex partner, a history of other STD, previous trichomoniasis infection, and sex without a condom. Laboratory diagnosis of trichomoniasis: cell cultures, antigen test, antibodies bind if the Trichomonas parasite is present, which cause a color change that indicates infection. Tests that look for Trichomonas DNA. Examining samples of vaginal fluid for women or urethral discharge for men under a microscope. Recommended treatment. Your nurse or doctor will prescribe antibiotics to treat the infection, either metronidazole or trinidazole. You usually only have to take one dose of medicine, meaning you can take all the medicine at one time. Patient care nursing consideration of trichomoniasis. Educate patient the preventative measures to avoid getting trichomoniasis by avoid vaginal, anal, oral sex. Be in a long-term mutually monogamous relation with a partner who has been tested and has negative STD test result. Use latex condom the right way every time you have sex. This can lower chance of getting trichomoniasis. Another approach is to talk about the potential risk of STD before you have sex with new partner. That way, you can make informed choices about the level of risk you are comfortable taking with your sex life. Therefore, I conclude it's better to maintain a monogamous relationship to avoid and protect from trichomoniasis, and be vigilant to choose your partner because trichomoniasis is a serious disease, and if left untreated, it can lead to severe health problems from both women and men. Monogamous relationship, it means a single partner. Dili siya parehas sa uban nga daghag uyab or bana o bisan kinsa ra mang iyahang ka-sex. What is primary amoebic meningoencephalitis? Primary amoebic meningoencephalitis is a rare and fatal disease of central nervous system causing inflammation of the brain and meninges, sore throat, severe frontal headache, hallucination, nausea, vomiting, high fever, and stiff neck. The system involved of the primary amoebic of meningoencephalitis, it is the central nervous system. The pathogen of primary amoebic meningoencephalitis, it is Naegleri fowleri, which means commonly referred to as the brain-eating amoeba or brain-eating amoeba, is a free-living microscopic amoeba, single-celled living organism. It can cause a rare and devastating infection of the brain called primary amoebic meningoencephalitis. The reservoir and the mode of transmission in the primary amoebic meningoencephalitis. The water and soil serves as the reservoir, and the mode of transmission is the amoeba usually enter the nasal passage of a person diving or swimming in the amoeba contaminated water such as ponds, lakes, the old swimming hole, thermal spring, hot tubs, spas, and public swimming pool. The sign and symptoms of primary amoebic meningoencephalitis, it is the headache, fever, stiff neck, anorexia, vomiting, altered mental status, seizure, coma. The laboratory diagnosis of primary amoebic meningoencephalitis, it is the visualization of actively moving and fowleri trapezoids in a wet mouth swab preparation of freshly centrifuged cerebrospinal fluid (CSF) sediment not previously represented or frozen, or second is visualization of N. fowleri trapezoids in a smear of centrifuge CSF sediment stain and JAMSA right or modified trichrome stain, or next is visualization of N. fowleri trapezoids by indirect fluorescent antibody in the slide secretion of either hematoxylin eosin H and E stain and fixed frozen brain tissue, or HE stain fixed brain tissue samples. And then demonstration of N. fowleri DNA by polymerase chain reaction from CSF or unfixed brain tissue samples. Recommended treatment. Therapies include intravenous and intrathecal amphotericin B. Other drugs used include azithromycin, rifampin, and azole drugs. And next is intensive supportive care required. Patient care and nursing consideration of the primary amoebic meningoencephalitis. Based on the patient's signs and symptoms, which he or she will develop seizure, make it sure the patient is safety at first by placing the side rails up and wrap it with a blanket so it will serve as a protection from the patient's head. Second is frequently watch the patient temperature as he or she is high risk for developing a fever for forming a tepid sponge bathing, and give acetaminophen as order for fever. Then, promote safety and guide the patient in going to the bathroom and frequently reorient the patient due to his symptoms of altered mental status and provide a well-lit room during the daytime. There's some pictures that I want to show you about the primary amoebic meningoencephalitis. In summary, I would say that cleanliness is must at all times. We should avoid going for swimming if we don't know the pool is contaminated or the water is stagnant. And it's poorly chlorinated for our safety because primary emetic meningoencephalitis is always near and fatal and very alarming disease for humans. And once infected, with early identification and treatment and management, brain damage will be prevented. So that's all of my discussion and video presentation. Thank you for listening and watching. I hope you have learned something about my topic.